Good evening, Mr. T. My name's Pete. I'm going to be the practitioner who's going to be doing your physical assessment today. Before we get started, do you need to empty your bladder?
No.
All right, are you comfortable?
Yes.
Excellent. So, to begin with, patient's general appearance is normal. His behavior seems appropriate, normal affect, body structure also, no issues so far, and mobility, both with body structure and mobility. I can't really assess in depth right now, but I will get into a musculoskeletal assessment later where I can do that more thoroughly. I will say that in a clinic situation, the patient would likely be wearing a hospital gown. My volunteer is going to keep his shorts on. It's no problem. I'm just going to verbalize assessments that I'd be looking for and assessment findings that I would likely find. So to begin with, could you tell me your name and date of birth?
Mr. T, 12/31/91.
All right. And where are we right now?
Your home for an assessment.
Excellent. Can you tell me today's date?
February 2nd, 2020.
And the day?
Sunday.
And about what time is it?
About 5 o'clock in the evening.
All right. How did you get here today?
Drove myself.
All right. And if you hadn't been able to drive yourself, how do you think you would have gotten here?
Probably asked a family member or friend to drive me.
All right. So patient's alert and oriented ×4. His speech is clear. Appropriate judgment. I was able to give him a little problem to work through, and he worked through it with no issue. Now, Mr. T, I'm going to go into an assessment of your vital signs, beginning with your temperature.
Okay.
If you could just hold this under your tongue, and when it beeps, you can give it back to me. While you're doing that, I'm going to count respirations. Temperature is 97.1 is normal. Respirations, about 3 for a 15-second period, multiplied by 4, 12, so about 12 per minute. Normal is 12 to 20, no issue there. I'm going to check your pulse. About 20 beats in a 15-second period, so about 80 beats per minute. I'm just going to take your blood pressure now. I'll be doing a palpable systolic blood pressure. I'll be listening. So if you just relax your arm. There we go. All right, about 122 systolic blood pressure. I'm just going to inspect your head now. It's part of the HEMT inspection. Just going to palpate, wash my hands, put on some gloves probably. But then I'm going to assess the scalp. Let me know if you feel any tenderness. So the face appears symmetrical, no issue with the skull. The scalp appears normal, distribution of hair appears normal. Whole configuration of the skull doesn't appear to be any issues there. So I can also tell, just looking at his eyes, the lids are intact, the lashes are intact, conjunctiva is clear, the sclera is clear, so no issues with the eyes that I can see. I'm going to do a quick vision test. Use my Rosenbaum card here, hold it about 12 to 14 inches from your face. If you could cover your left eye for me, please, and then read this line and then as far down as you can.
Okay. 374258, 937-826, 439739.
All right, and then cover your right eye, please. And with your left eye, again, read just the bottom 2 lines for me.
374258, 937-826, 426739.
All right, perfect. And then if you want to uncover both eyes, and then just read the bottom line for me if you know.
426739.
All right. So patient has 20/20 vision according to the card, so that's excellent. What I want to do now is an assessment of your pupils. I can see that the patient's pupils are equal and round, about 7 millimeters. Grab my light. I will shine my light into each eye one at a time. So first the left eye, pupil reacts, and the right, pupil reacts. Now I will shine a light in the left eye and look at the right, and there's a reaction, and then shine in the right, look in the left, also reacts. So what I'm seeing is that the pupils are equal, round, and reactive. They also are consensual in their movement. Stay right here at the light for me, and then back at the wall, and back at the light, and back at the wall. Pupils are showing accommodation when a patient looks at an image far away. The pupils dilate, and at an object close by, the pupils constrict. So that also is normal. What I want to do now is check something called the red reflex. What I'll do is with my right eye, look at your right eye for what's called a red reflex, and then with my left eye to your left eye. So what I'm going to do is step here, and then shine a light in your right eye, and positive, and then left, and it's positive. So red reflex is present in both eyes. Shut my light off here. I'm going to check your sinuses now. So I'm going to be palpating around your face. Let me know if you feel any tenderness. First, the frontal sinus above the eyebrows. Any issue?
No.
Tenderness. And the maxillary sinus. Any issue?
No.
Outstanding. So no issues with the sinuses. Appears to be normal. I'm going to do a quick inspection of your nose. The nose appears symmetrical. If you could hold your right nostril shut and sniff through your left, and then on the opposite side, do the same. No issues there.
No.
Excellent. So both patent. Look. Pink mucosa. Clear. Normal. Clear. No issues. Patent. The septum looks normal. So nose looks good. Change my apparatus again. I'm going to take a look at your ears. The first thing that I'll do is inspect the exterior, look at the skin, any pain or tenderness when I pull the tragus or the pinna,
No.
or the auricle. No, okay, great. And on the other side, same thing. Any pain or tenderness?
No.
Cool. All right. No redness, no discoloration. This looks normal. Light shining. And when examining the inner ear, what I want to do is angle the speculum towards the nose. I want to pull up and back on the auricle. Get a good look at the ear canal. Canal appears pink, clear, little wax, tympanic membrane. It's like a pearl gray. I get a nice cone of light, that tympanic membrane reflex. Same on the left side. I'm going to pull up on the auricle and back. Angle the speculum towards the nose. And take a look at the canal, which, again, pink, clear. Tympanic membrane appears pearl gray. And you get that nice reflex with the cone of light. All right. So now I'm going to do a quick test of your hearing and do something called the whisper test. All right. If you could cover your left ear with your hand, and then close your eyes and repeat after me. Bow tie.
Bow tie?
Excellent. Cover your right ear with your eyes closed. Leopard.
A leopard.
Perfect. So, patient is able to correctly identify both words. Do a quick inspection of your mouth. I don't have a tongue depressor, but I have a handy disposable toothbrush, which is going to stand in for my tongue depressor right now. The lips appear normal. They're not dry or cracked. Mucosa appears normal. Gums are... open up your mouth for me really quick. Shine a light, pull your tongue. Perfect. So the mucosa is pink and moist. Gums, pink, moist. Teeth all appear to be intact. Both the hard and the soft palate appear normal. Pharynx all appear good. Shut my light off. All right, so from here, I'm going to be feeling around your neck. I'm going to palpate the carotid pulse and get an amplitude +2. On the left side, carotid pulse. Again, amplitude is good, +2. I'm going to listen with the bell of my stethoscope. Apologize if it's a little cold. Flip to the bell and listen for a bruit. Good carotid bruit. Bilaterally with the bell stethoscope. And Do a quick palpation of the neck, tracheal deviation, Adam's apple, trachea is midline. If you could, hold this glass of water for me. I'm going to assess the thyroid. Again, I want to find Adam's apple, tracheal cartilage. And if you want to take a sip of that water and swallow for me. Excellent. No issue swallowing. Everything appears normal there. All right, I'm going to do a little bit more feeling now. I'm going to feel, I want to make sure I don't block the camera. I'm going to feel basically lymph nodes. First thing that I want to do is come in and get the posterior auricular lymph nodes. Also want to get the pre-auricular up front, and the posterior auricular and the occipital around the back. The superficial cervical lymph nodes. Also want to get the deep cervical chains, posterior cervical, palpate the supraclavicular. Any pain or tenderness when I do any of this?
No.
Excellent. I want to get the tonsillar as well as the submental, submandibular. All right. Any pain or tenderness there?
No.
Great. No swelling, no abnormalities. The lymph nodes all feel good. Now, what I'll do is an assessment of your upper extremities. When I'm doing this, I'm looking for skin abnormalities. Is the skin warm or cool to the touch? His is warm. Palpating the radial and brachial pulses. Amplitude of +2 and +2. On this side, radial and brachial pulses. So +2, +2. The skin is warm, it's not pale. Capillary refill on the left side, it's less than 2 seconds. There's no clubbing of the nails. The nail angle is it's normal, it should be about 160 degrees. Anything more than that could be an indication of oxygenation issues. On the right side also, capillary refill less than 2 seconds, and the nail appears appropriate. If you want to hold your arms out for me while I assess the lymph nodes of the upper extremities, I want to make sure I get central, make sure I get the lateral, make sure I get the pectoral and the subscapular, make sure I get the infraclavicular as well. And any pain or tenderness through any there?
No.
All right, no swelling, no pain, tenderness, outstanding. If I could have you turn around actually on the stool, I'm going to do an inspection of the posterior thorax. Again, patient ideally would be shirtless in this scenario. I would want to see, is the back, is it symmetrical, are the breasts normal? I want to palpate the area for any pain or tenderness. Get a good look at the EP diameter, make sure that it's about 2 to 1. It is with him, so again, normal data there. If you could take a deep breath in for me and exhale. Excellent. So breaths appear even unlabored. Just going to do a quick palpation of the spinal processes, of the paravertebral muscles. Any pain?
No.
Feeling either? Excellent. I want to do now what's called percussion. Okay. What I want to do here is I want to place my middle finger over the area I'm percussing and then tap on my own finger, listening for tympany or dullness, and then also assessing for pain. I'm going to go down the intercostal spaces of each side. All right, so let me know if you feel any pain, okay? 1.
No. 2. No. 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 No.
All right, outstanding. So no pain, no issues there. It all sounded appropriate. I'm just going to listen to your back now. If you want to breathe in deeply through your mouth when I tell you, I'm just going to listen down your back. All right. Deep breath. Through the mouth, exhale. Deep breath through the mouth. Exhale. And 3, deep breath through the mouth. Exhale. And 4, deep breath through the mouth. Exhale. And 5, deep breath through the mouth. Exhale. And 6, deep breath through the mouth. And exhale. 7, deep breath through the mouth. Exhale. 8, deep breath through the mouth. Exhale. 9, deep breath through the mouth. Exhale. And 10, deep breath through the mouth. And exhale. All right, sounds good. I'm just going to do a percussion, one more area, the costovertebral area, for any tenderness. Bump here.
No.
Any area there. Okay, excellent. So no tenderness there. At this point, I'll have you turn around back so you're facing the camera. If I were assessing a female patient, I would do my breast inspection, my breast exam now. I would want to assess for size and symmetry of the breast. I would want to assess for any palpable masses or observable masses. I would have the patient hold the arms at the side, on the hips, extended overhead. Assessing for any dimples, any abnormalities. I would want to make sure that I have the patient at some point position the arm under the scapula, also perhaps side lying, arm overhead, or just arm overhead while standing. Palpate all areas of the breast, including the nipple and the tail of Spence. I would want to teach the patient how to perform a self-breast exam, including all the areas I just mentioned. They would want to do this monthly at least. They would want to do it after a period. They would also, they could do it in the shower, lying on their side with arms in all the areas, basically all the ways that I just explained. I would have them do it themselves. I'm going to do a quick listen to your chest. Again, the patient would ideally be shirtless, assess the skin, pale, warmth, if there's any abnormal lesions, rashes, anything like that. I would note the symmetry of the chest in terms of breathing. Chest appears to be even, the breath's unlabored, so no issues there. The rhythm appears normal, effort is again normal. I'm just going to listen to both sides of the chest. All right, so if you breathe in and exhale, and 2, breathe in, exhale, 3, breathe in, exhale, 4, breathe in, exhale, 5, breathe in,
It's 10:20 p.m.
exhale, 6, breathe in, exhale, 7, breathe in, exhale, 8, breathe in, exhale, 9, breathe in, exhale, 10, breathe in, and exhale. And it sounded like I may have activated our Alexa there for a second. So, breaths appear even and unlabored. There doesn't appear to be any abnormal bulges or any issues there. The lungs, upper, middle, and lower all sounded clear. So, from here, we will get up and move over to our couch where I'll perform the rest of the chest and abdominal assessment. All right, yeah, if you want to just lay down, that'd be perfect. All right, so ideally in a clinic, we'd have examination table, recliner, something that I could have the patient lay down on. But again, we're gonna have to improvise a little bit. We're gonna use a couch. So what I wanna do here is go into an assessment of the anterior chest, precordium. First thing that I would do, actually, I'm gonna have you lie a little bit to your left. Put a pillow behind you. Perfect. So inspection of the chest, rise and fall. Basically, can you actually come this way just a little bit? All right, perfect. Sorry about that. All right, so basically what I want to do is observe and palpate for any pulsations, any lifts or heaves. I want to be assessing for thrills. I want to palpate over the fifth intercostal space, or the point of maximal impulse, just to see if I feel anything abnormal. I can palpate the pulse just fine. I'm going to go into the listening portion of the chest assessment. I want to listen with both the bell and the diaphragm of my stethoscope. So starting with the diaphragm, on the right second intercostal space, or the aortic area, and then moving to the pulmonic, the left second intercostal space, down to the Erb's point, the third intercostal space, the fourth intercostal space for the tricuspid valve, the fifth intercostal space, the mitral, and then here's a good place to listen for the apical heart rate. I'll listen for 1 minute, starting now. So exactly 82 beats per minute. I'm just going to listen with the bell of my stethoscope in the same area. Second intercostal space on the right. Second intercostal space on the left. Erb's point, the third intercostal space on the left. Listen for the mitral valve, fourth intercostal space. Tricuspid at the fourth intercostal space, excuse me. Mitral at the fifth intercostal space. And all sounds normal. So from here, I'll move into an abdominal inspection. And what I'd like to do is take the pillow from behind you and place it under your knees. So your knees are a little flexed. I want to make sure your knees are nice and comfortable while they're flexed. First thing that I would do, also make sure the patient is draped appropriately. I would, want them to be covered for their privacy. I want to do a skin assessment, much like I did with all the other areas. Again, pale, abnormal colors, abnormal lesions, any abnormal marks. Is the skin warm? Looking at the contour of the abdomen, feeling for pulsations or movement. I expect to see a little bit of pulsation in the aortic area, but nothing too great or large. Everything appears normal. What I'm going to do is listen for bowel sounds first. Listen in all four quadrants. And present. Bowel sound present. Bowel sounds present. And present. If I didn't hear any bowel sounds, then I would want to listen for a full minute to be sure that there were actually no bowel sounds. I will flip over to the bell of my stethoscope so I can listen for the aorta, and I can feel the pulsations and listen for the bruit, about 80 beats per minute. And I want to listen for the renal arteries bilaterally. Again, normal, I can hear about 80 beats per minute. I want to listen to the femoral arteries bilaterally. I could probably hear and palpate easier, again, if the patient wasn't wearing shorts, but for the volunteer's comfort, we will leave the shorts on, but we wanted to listen bilaterally to the femoral arteries. All right. What I could feel were normal for the bilateral femoral arteries. I can't really speak to actual amplitude because the patient's wearing shorts. But if I had to guess, I would say again, 80 beats per minute and +2 amplitude. I'm gonna do some percussion of the abdomen, much like I did before, percussing on my own finger in all 4 quadrants of the abdomen. Any pain when I do that at all?
No.
So I'm listening for tympany or dullness. Everything feels normal. I get a good resonant sound. I want to do some light palpation of the abdomen for any pain in any of the areas in all 4 quadrants.
No.
Anything? I want to do some deep palpation in all 4 quadrants. So I'm going to go a little bit deeper than before. Top right quadrant, okay? Any pain there?
No.
Bell on the left.
No.
And left lower quadrant.
No.
And right lower quadrant.
No.
All right. I'm going to check for some rebound tenderness. So what I'm going to do is do some deep palpation and pull my hand away quickly. Let me know if you feel any tenderness.
No.
All right, excellent. So no rebound tenderness, no issues with deep palpation. Again, I can palpate the aortic pulsation. I could probably see better if the patient were shirtless, but I would expect to see a little bit of pulsation with the aorta. Again, I would also make sure to judge the amplitude of femoral pulses on palpation. The other thing that I want to do while I'm over here is assess the right costal margin for the liver. I want to assess location of the liver. Any tenderness when I palpate here?
No.
And this can also be assessed for through percussion. If I were to percuss up the side of the abdomen, I would be able to hear some tympanic noises, and it becomes more dull as I get to the area of the liver. And then one last thing that I want to do while I have you in this position is check for hernia. So if you want to just lift your head up off the pillow. All right, no issues there. You can go ahead and relax.
No.
So no hernia present, and that's good. That's what we expect to find. I'm just going to come around to the foot here, adjust my camera a bit as I assess the lower extremities. Just there. All right. So I'm assessing the lower extremities for, I apologize, you can't see my face, but I want to assess the lower extremities for color. I want to assess them for warmth. They both appear to be warm. I want to do an assessment of the post-tibial and dorsalis pedal pulses at the same time. I get a +2 amplitude there. I want to assess the capillary refill. Again, less than 2 seconds bilaterally. I'm basically feeling over bony prominences for any edema, of which I feel none. And there doesn't appear to be any varicosities at this point either. So the lower extremity assessment appears to be normal. Now at this point in my assessment of the male patient, I would go into an assessment of the genitalia. I would want to basically palpate the scrotum and the penis. I would want to observe hair distribution. I would want to palpate for masses. Is the area tender? Assess the skin of the area. Does the skin look abnormal? Are there any abnormal marks or lesions or anything like that? I would want to palpate the testes, the vas deferens, the epididymis, and I would want to teach the patient how to perform a self testes exam. Again, you could perform it in the shower, in the mirror, at least monthly. I would want to teach him and also myself on inspection want to visualize the meatus, both the location and if there's any abnormal discharge, anything like that. Again, teach him all those things and how to perform those assessments as well. All right, Mr. T, if you want, you can stand up. We'll head back over to the stool and move on to the next portion of the assessment. Move your hand. Excellent. All right, camera okay? Good. All right, so now we're gonna move into an assessment of the cranial nerves, okay? The first one that I wanna do is the olfactory nerve, so cranial nerve 1. And how I wanna do that is have you close your eyes and close off your left nostril if you can. I'm gonna hold something in front of your nose for you to smell and you identify it for me.
Coconut.
Perfect. All right, and now close off your right nostril for me and keep your eyes closed. I'll have something else for you to smell.
Vanilla.
All right, perfect. You can open up your eyes. We're gonna move on now to, excuse me, the optic nerve. And what I want to do here is an assessment of vision through something called confrontation. I want to make sure the camera can see me. If you can angle this way towards me a little bit. What I'm going to do is I'm going to hold a hand over my left eye. You hold yours over your right. And then tell me how many fingers that I'm holding up.
2, 3, 3.
Excellent. Now cover up your left eye. I'm covering my right. And again.
2, 3, 2, 3, 4, 1.
All right, excellent. Just one there, but you got the rest of them just fine. We're going to move on to the third, fourth, and sixth cranial nerves. Those would be the oculomotor, the trochlear, and the abducens. What I want to do for these, first off, do cranial nerve 3. Stay right here at my nose first, and then stay here, tip, and just keep your eyes fixated here without moving your head, okay? Excellent. All right, so basically what I'm doing there is taking his eyes through all 6 main fields of vision, holding the light off to one side to assess for any nystagmus, of which I see none. Now I'm going to do a little bit of light sensitivity. If you stare at the wall behind me, pupil reacts, and there's, again, accommodation, or again, the lights react in a consensual manner, much like they did prior assessment. And then the last thing that I want to do is called the cover-uncover test. So look right here at my nose, and then hold your right eye, or hold your left hand just to the side of your left eye, and then cover and uncover. I'll do the same on this side, and cover and uncover. There's no movement with the eyes, so this nerve appears to be intact, perfectly normal. I'm going to assess the fifth cranial nerve, or the trigeminal nerve. What I want to do here is palpate around the temporal and masseter muscles. If you could clench your teeth for me. All right, you can open up your mouth. Excellent. And then what I want to do is test dull and sharp sensation and light touch. This is going to be light touch. That's dull and that's sharp, okay?
Okay.
So if you close your eyes for me, feel that?
Yes.
And this,
Yes.
and that,
Yes.
and that,
Yes.
and that.
Yes.
All right. So sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
All right. Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Mm,
Let me do it again.
Sharp.
And sharp or dull?
Sharp.
Excellent. So a little, you can open up your eyes there. So a couple misidentified there, but I think you hadn't been exposed to the sharp or the dull enough on your face. You got them right afterwards, just fine. I'm going to move on to the 7th cranial nerve now. Basically, what I want you to do is close your eyes real tight for me and open real wide, smile real big, puff your cheeks out like a pufferfish. Excellent. So, 7th cranial nerve appears to be intact. I'll move on now to the auditory nerve. This is a fun test called the Weber test. And what I'm going to do is I'm going to ping the tuning fork and I'll hold it actually with the Weber test, I'm going to hold it to the midline of the skull, okay? And basically what you're going to do is you're going to hear a sound and tell me if you hear it more left, right, or middle, okay? So close your eyes, yeah.
Right in the middle.
All right, perfect. And then I'm going to go on to the Rene test. The Rene test, I'll do the same thing. I'll ping the tuning fork and then I will hold it on the mastoid bone and tell me if you hear it, okay? And then I am going to hold it there. Let me know when you can't hear it any longer. And then I will place it next to your ear and you can tell me if you still hear it. And what I'm testing for here is whether or not he's able to process sounds better through air or through bone conduction, because that'll tell me a little bit about how the nerves are working, okay? So, close your eyes.
I hear it.
And tell me when you don't hear it anymore.
I don't hear it. I hear it again.
All right. Was it louder on the bone or over the ear?
Over the ear.
Okay, perfect. About 30 seconds. All right, so one more time on the right. Close your eyes for me.
I hear it. Yep.
Excellent. So tell me when you don't hear it anymore.
I don't hear it anymore.
And now?
I hear it again.
All right, so after about 20 seconds, did you hear it more when I held it on the bone or?
By my ear.
Right here. All right, so perfect. So 8th nerve is intact. That was perfect. I'm going to move on to the 9th and 10th cranial nerves. Those would be the glossopharyngeal and vagus nerves. For this, I'm going to need my fake tongue depressor, the stethoscope. The toothbrush. All right, open up your mouth for me and say ah.
Ah.
Uvula rises. I'm going to elicit a little gag reflex here. I apologize. Oh, all right. Excellent. Can you swallow for me? All right, perfect. So, no issues there. I'm going to now go on to the 11th spinal nerve, the 11th cranial nerve, which is the spinal accessory nerve. And I want you to rock your head from side to side, ear to ear. I'm going to do it against the pressure. Go ahead and keep doing it. And turn your head side to side. And shrug your shoulders. All right, so no issues there. Move on to the 12th and final cranial nerve, the hypoglossal. Just stick your tongue out for me and kind of move it around, up and down. Excellent. So, 12th cranial nerve, all cranial nerves in fact are intact, so no issues there. Now that we're done with the cranial nerves, I'm going to need a little bit more space, so we're going to move into the kitchen. I'll turn the camera around and then do musculoskeletal, okay? All right, so we completed the cranial nerve assessment. We're going to go into just a quick musculoskeletal assessment. If you could turn this way. Basically what I want to do here is I want to assess the shoulders. I want to assess for symmetry. I want to make sure that there's no abnormalities either in the shoulders or in the iliac crest. So the iliac crest, no issues there. If you could just bend over and let your arms dangle, perfect. So I'm basically going to run my hand all the way down the spine I'm assessing for scoliosis, any abnormal bends. I want to make sure that the curvature of the spine is normal. You can sit back up and then turn towards me. I want to assess the temporomandibular joint. You want to just open your mouth for me and clench your teeth and sort of bite side to side. Excellent. So no clicking, no issues there. Everything appears to be normal in this area. I'm going to do some range of motion through the shoulders. I would like, if you could hold your arms out and forward and up. Let me get behind you really quick. Come down with them and back and forward and down. One little crack but no crepitus. If you could bring your head side to side, left and right, all the way around. All right, no cracking, no issues there. Any pain when you do any of that?
No.
Okay, excellent. Now if you want to shrug your shoulders, hold up against me. All right, perfect. So the trapezius muscle has good strength. It's got good strength in the temporomandibular joint. Shoulders appear to have good range of motion. So no issues there. Moving on, I'm going to do an assessment of your upper extremities. You want to have a seat for me right here. Make sure the camera's got you. Excellent. So we'll start on the left side. If you want to do some flexion of your arm and through the wrist, don't feel any crepitus, little tiny crack that doesn't count. Wiggle your fingers for me. All right, spread your fingers. All right, good +5 strength there. Give me a good hand grip. Excellent. +5 strength. Pull your hand in towards your face. All right, good +5. And push away and +5. So good strength through the top upper left extremity. No crepitus. You know, on the right side, and again, do some flexion. Move your wrists for a full range of motion. Move your fingers. Excellent. So no abnormal cracks, no abnormal sounds that I'm hearing. Spread your fingers wide and good strong grip. All right, pull in. Good +5 strength there and push away. Excellent. So good +5 strength in the upper extremities. He's able to move through good range of motion. He's able to do all this without any abnormal cracks or anything like that. I'm going to assess the lower extremities now. Let me adjust the camera really quick. Make sure I can get your feet in. Perfect. So what I want to do here is have you wiggle your or move your ankle through a full range of motion. Good, no crepitus there. Push down on the gas pedal, pull your toes to your nose. Wiggle your toes for me. Good, no crepitus, no cracks, a good +5 strength in both those commands. Pull your heel in towards the chair and push away. All right, good +5 strength in the left lower extremity. On this side, do the same. Move that ankle through range of motion. Good. Push down on the gas pedal. Pull up. Good +5 strength, both with dorsiflexion and plantar flexion. Pull your heel in towards the chair. All right, and push away. All right, good. Good +5 strength in both motions there. No crepitus, no musculoskeletal issues through here that I can tell. One thing that I would like to do, if you could stand up for me. I'm going to move this stool out of the way. While we have the camera in this position, if you want to have a lay down on the stool here, on the bench here. All right. What I want you to do is bring your knee up to your chest and down, and again, and down. Good range of motion through the hips and the knees. Now on the left side, do the same. No crepitus. Again, up. Good range of motion in the lower extremities. Excellent. You can stand up if you like. I'll be up. Awesome. All right. So I'll move the camera now so we can get set up for our next section. I believe we can see good there. All right. So we're going to do an assessment now, cerebellar sensory assessment. If you want to stand over by my oven over there, and then just walk right across the kitchen, heel to toe. All right, turn and come back. Good heel to toe, even gait, proper arm swing, no issues. You want to come back to center, that'd be great. Do something called the Romberg test now. I'm going to have you cross your arms across your shoulders. I'll stay close by. No swaying, even balance. Close your eyes for me. All right. No swaying, no balance issues. You can open up your eyes for me. All right, you can relax your hands. If you can now just hop on one foot, left foot first. Excellent. Now the right. And excellent. And now if you could just do a couple deep knee bends for me, however's comfortable. Awesome. So no abnormalities, he's able to perform the functions just fine. I'm going to move the stool back over because I'm going to need to go into some fine motor examination here. So if you want to have a seat. The first thing I'll have you do is hold your hands up, rapidly tap your fingers. I'll touch your first finger to your thumb, second, third, fourth, and back. Excellent. Hold your arms out for me. Touch your finger to your nose. And on the other side. Excellent. If you could turn around so that the camera gets you. I'd like you to place your left heel on your right shin and rake it down. And right heel to your left shin and rake it down. Excellent. So no issues there. All right, I'm going to do a couple other tests. I'm going to do some light sensitivity, some touch. If you could close your eyes for me, I'm going to do some light touch. Hold your left arm out for me.
I feel that. I feel that.
And then this is dull, and this is sharp.
Okay.
This is dull or sharp.
Sharp.
Dull or sharp.
Sharp.
Dull or sharp.
Sharp. Dull. Sharp.
Excellent. All right, so he's able to distinguish between dull and sharp in the left upper extremity. I'm going to go now to the right. And close your eyes for me. Tell me if you feel this.
Yes. Yes.
All right. And then dull or sharp.
Sharp.
Dull or sharp.
Sharp.
Dull or sharp.
Sharp.
Dull or sharp.
Dull.
All right. So he's able to, again, properly identify dull and sharp. I'm going to do one more test with the tuning fork here. What I'm going to do is I'm going to engage the tuning fork. I'm going to hold it to your lower extremity and then tell me when you can no longer feel it. Okay.
Okay.
So if you hold this down, feel that?
I feel that.
Keep your eyes closed and let me know if you can't feel it anymore.
I don't feel it.
Okay. Now on the other side,
I feel it.
tell me when you can't feel it anymore.
I don't feel it anymore.
All right, sounds good. I'm going to do the same thing on your lower extremity, so let me adjust the camera really quick, and then we'll be able to get you in the shot. All right. So again, close your eyes for me. I'm going to do some light sensation and dull. Just let me know when you feel.
I feel it. Feel it.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
All right. Now I'm going to use the tuning fork. Again on the left extremity, keep your eyes closed. Tell me if you can feel it.
I can feel it.
And tell me when you can't feel it anymore.
I don't feel it anymore.
All right. I'm going to move over to the right side. Close your eyes for me. Tell me when you feel. A little light touch.
I feel it.
All right. And now?
Feel it.
All right. Tell me if you're sharp or dull.
Dull. Dull. Sharp. Dull.
All right. And now with the tuning fork, I'm going to activate the tuning fork. Tell me if you can feel it.
I feel it.
And tell me when you no longer feel it.
I don't feel it anymore.
All right. Excellent. All right. So now you can open up your eyes. I'm going to go on to a test called stereognosis. What I'm going to do is I'm going to have you close your eyes. I'm going to place an object in your hand and see if you can tell me what it is, all right?
Okay.
So go ahead and close your eyes for me.
The tuning fork.
All right. You can open up your eyes. I'll move to the other side. Go ahead and close your eyes.
Hair comb.
Perfect. All right. You can go ahead and open up your eyes. I'm just going to adjust the camera one more time so that I can get some reflexes here. All right. So first reflex I'm going to check is the brachioradialis reflex. If you hold your left arm out, I'm just going to tap on your left wrist here. Just hold it gentle. I'm actually going to let you. All right, I got a flinch there, so a positive test. I'm going to go up now to the biceps tendon. For this, I actually strike my own finger. I'm assessing for movement here. All right, so I got a little bit of a quiver there. I'm also going to assess the triceps tendon. So I got a movement there, so positive triceps. Place that hand there. I'm going to move to the other side. Same thing over here. Brachioradialis. Just hold that. All right. So I got a positive movement there. Now I'm going to move on to the biceps tendon on this side. Got a little movement there, so a positive response. Now I'm going to do the triceps tendon. I got a positive response there, so that tendon, that reflex is intact. Before I move down to the lower extremities, there's one more test that I want to do while you're sitting upright and I've got the camera on you. This is a test for graphesthesia, okay? So what I'm going to do is have you hold your palm out, and I'm going to draw a number in the palm of your hand with your eyes closed, and try to identify it, okay? So close your eyes.
6.
Perfect. Now move to the right side. Hold your hand out. Close your eyes.
2.
That was perfect. All right. So well done there. I'm going to adjust the camera one more time. And we're going to test deep tendon reflexes of the lower extremities. First one I'll do is the patellar tendon on the right side. Oh, there we go. So we got a good response there. Now the Achilles tendon. Got a little flinch there in the ankle, so positive response there. Now to the left side. Okay. Positive response there. And then the Achilles tendon. You got a movement there for the Achilles. Very last thing I'll do is we'll test your Babinski reflex. If you want to kind of lift your foot up here, tell you what, I'm going to move the camera down a little bit more. I'm just going to read you the Achilles assessment very quickly because I want to make sure the camera gets it. So for the Achilles, I'm striking the back of the ankle. I'm looking for a response. The foot there, which I got. Same on the right side. I'm just going to dangle that limply. Back of the ankle. And I get a little response there. So again, very last reflex, the Babinski reflex. If you want to hold your foot out for me. What I want to do here is drag my utensil up the lateral portion of the foot over to the center and test for normal response. So what I get here is a flexion of the toes. That is a normal response. Abnormal would be a fanning of the toes. Do the same thing on the right side. Again, test the Babinski reflex. And I get a nice, good, strong flexion of the right toes. No abnormal fanning. Move the camera one last time so I can get expression. This is going to conclude our head-to-toe physical assessment. I want to thank my volunteer, Mr. T, one more time. I appreciate you coming out, and that's going to be all for us today.